Hey, Remar nurses, we are live. This is what we do every Monday, how to pass NCLEX. I'm bringing you NCLEX content. You know what time it is. I am your number one NCLEX instructor. And today we are focusing on NCLEX critical thinking. I love this topic. My name is Regina Callion. Come on, let's go. Let's get ready. So the critical thinking exercise that we're going to do, we've done it in the past. It is name the diagnosis. And today I will be presenting you clinical cases and symptoms. And I want you to tell me what the diagnosis is. Now we're going to be doing the ABC edition today. So ABC means that we're going to go in alphabetical order with the conditions. So that's all I'll say. That's all I'll say for today. That's the only hint that I am giving you. And also, if you missed Black Friday, it's all right, because we are doing Cyber Week this week. So we still have all of the amazing products right here on sale for you guys. If you're ready to study for NCLEX, the time is now. Go ahead and hashtag cyber if you want to check out what I'm doing special for you today. Just put hashtag cyber and Team Remar will hit you up. All right. Let's get into this critical thinking exercise. I hope you guys are ready. Because I'm bringing it today. First, hey, name that diagnosis. Remar nurses, this is patient A. They come in with this. They have oily skin. They have papules, hot spots. The skin is painful to touch, and cysts may be present. Oh my, what is this? I want to see comments on the screen. Here. What do you think this condition is? This is what I like to call name the diagnosis. And it's all about getting you to think outside. Oh my goodness, think outside the box. And I'm not presenting you options. So you either know it or you don't know it. Now you either know it or you don't know it. So I'm waking you up on this Monday. I see some interesting things on the screen. I see some interesting comments. So some people think it's shingles. Some people think it's heart failure, DVT. Some people are saying acne. What do you guys think it is? Hey, this is name that diagnosis. You are live. You made it. You're in the house. And the correct answer, it's acne. It's acne. It is acne for the day. So right now, remember, and I said this is ABC edition. So acne, oily skin, papules. Definitely know the difference between macules and papules and pustules. Know your skin characteristics. The skin can be hot to the touch. It's painful, and cysts may be present. All right. Here is a question regarding the diagnosis. I want to see if you guys know it. Comments on the screen. Share this video too. So that other people can study with us Monday. A young adult female client is taking isotretinoin to treat severe cystic acne. Which assessment finding indicates a need for further education? Number one, the client recently had an intrauterine device removed. 2, the client already has acne scarring on her forehead. 3, the client is already applying an antibiotic ointment. Or 4, the client has a strong history of cervical cancer. Oh, good stuff. This is, if you're talking about acne, you need to know this point. I never let my students get away from it because acne is such a common issue that adults have, young adults have. And so you must know, you're gonna want to know the medications to treat acne. I see the comments on the screen. Couple comments. Come on, put them up quickly, guys. we got a lot to talk about today. We are doing, in fact, this is Name That Diagnosis. So if you're live, you're catching it. The correct answer, pow, it is number one. It is number one. And you guys know with this medication in particular, you have the complications of it being a teratogenic medication. So that means that if a patient becomes pregnant while taking this medication, it will definitely cause issues for that baby, And so we have for those of you, we have 600 people actually join the virtual trainer. You will go over that information with me, all right? Specifically, acne. When you look at age-specific nursing care, there are certain things that if you are a teenager, you will have these experiences that nurses need to know. So I will be coming back on later to talk about how to use your virtual trainer. For those of you who purchased it and are new to Remar, we're going to get into it. I'm going to actually take you inside of the virtual trainer, and we will be going over each and every metric that you have, how to be accountable, how to stay on track and on schedule. It is very important to me that you guys know how to use your virtual trainer. And if you are ready to get started and you want to see what discounts we have on today, #cyber, and we will make sure that you get access to your free trial of the virtual trainer or the virtual trainer itself. Okay, guys, let's get back into it. I got to tell you that we are going, and I told you about the Cyber Week sale, so that is happening. Somebody said, hey, how do I get there? It's actually remarnurse.com. Remarnurse.com is the website, okay? Remarnurse.com. So let's go on and do the next patient. This is patient B. All right. And this patient has blood in the urine. Oh, wait, let me say this. If you guys are on YouTube, #cyber, it is honestly just for Facebook right now. So if you're on YouTube and I see you guys saying, how do I get the VT? How do I get it? Please go to support@remarreview.com. All right. And just email Team Remar, support@remarreview.com, and we will make sure that we get that. All right. Thank you guys so much for being patient with us on that. All right. So this is the patient right here. All right. Blood in the urine. Sudden urges to urinate. Abnormal cells noted. Hey, bone and pelvic pain. What does this patient have? Bone and pelvic pain. And a cystectomy may be required. So what are you thinking here? I'll definitely tell you guys, with these signs, it's not a urinary tract infection. It's not a urinary tract infection. So look at it again. You have blood in the urine, sudden urges to urinate. Hey, abnormal cells noted. Bone and pelvic pain. Cystectomy may be required. I think everybody's missing the biggest clue. I see a lot of BPHs, benign prostate hypertrophy. I see kidney stones. I don't see the correct answer. It's not kidney stones. It's not BPH. It's not urinary tract infection. Think again. I see some person. Okay, one person got it. All right. One person got it. The correct answer, and you'll see. Okay, this is bladder cancer. Yeah, bladder cancer. You have abnormal cells noted. So you have that growth of cells. You have bone and pelvic pain. This is certainly not urinary tract infection. Okay, certainly not urinary tract infection. And you guys know when you have cancer, you have abnormal cells. So that's going to be one of the characteristics for NCLEX, because when they are talking about cancer, they never neglect to mention the abnormal cells. All right. And then you got to know cystectomy, that has to do with the bladder. So I gave you guys the actual organ at the end. And so make sure that we are studying our surgery terms, right? Our surgery pronouns. Those are very important because I gave you the answer with the abnormal cells and the cystectomy noted. All right. You guys, somebody got that. Somebody got that. And hey, let me stay here for a second. Let's go to the next patient. And I'll swing back around because I see questions on the screen. I'll swing back around to them. All right, what about this patient? This is patient C, and they have skin that is red. The location is swollen. It is a bacterial infection. So the patient is having chills and fever. Now, if this situation is not treated, it will be life-threatening. What do we have? What do we have in this instance? And there's some really good clues in here. First clue, I think the biggest clue is bacterial infection. Bacterial infection. And I will say that the skin is another situation. All right. So I see here allergies, allergic reaction. Not quite for a bacterial infection, right? And I think it can lead to sepsis. Some people are saying sepsis. It can definitely lead to sepsis, but it's not sepsis. Oh, meningitis. It's not meningitis. That's interesting. If it was meningitis, I would have definitely put nuchal rigidity because that's what NCLEX would have put. Okay, correct answer, tonsillitis, urticaria, not staph. Okay, the correct answer is, and I love the comments on the screen, it is cellulitis. Yes, so it is cellulitis. When a patient has cellulitis, it's a local thing. It starts by usually a break in the skin, right? A break in the skin, and then bacteria gets in that skin. And so it's very common. People with diabetes mellitus, they have a break in their skin. They don't know that they have it. People who are obese, honestly, all the patients that I ever took care of that had cellulitis were 400 pounds or more. So there is a correlation with obesity. There's a correlation with diabetes mellitus type 2 usually. And these patients, they either don't know that they have this break in the skin or they have poor hygiene, right? If you have poor hygiene or you're surrounded by poor hygiene, maybe you keep your body very clean, but your home, has dirt and things around it, and you can't clean your home as well. So this is a common condition, cellulitis. And so it's a bacterial infection where you can get a staph in there, right? You can get MRSA, like it can be really bad. All right. And so you have to know this. Let's do a question about this. Let me see here. A 37-year-old HIV positive client presents to the emergency room with concerns of cellulitis in his arm. Okay. The client admits to frequently injecting illicit drugs in that arm. Which primary prevention statement made by the nurse is the most appropriate for the client? Okay. Number one, your HIV was probably caused by illicit drug use. Please stop at this time. 2, stopping drug use will improve your life. 3, HIV increases your chances of infections. It is important to be safe. 4, the local clinic has a needle exchange program. Okay. All right. That's all I'm going to say. And I see the answers coming on the screen, and I see that people are getting, the majority of you guys say it's 3. The majority of, from what I'm seeing, between Facebook and YouTube is HIV increases your chances of infection. It is important to be safe. Are we all agreeing that that is the right answer? Because that's what I'm seeing. And hey, I like when you guys are on one accord. I really do. I always say that I like when studying brings us together and the comments are flowing, and there are mostly threes. So I'm seeing that. I do have some outliers. Some people are putting 2 answers down. We don't do that around here. You just pick one. So the correct answer, a lot of threes, a lot of threes. Do we agree? Are we all agreeing that it's 3? All right. I like when we're on one accord, but I like when we're on one accord and the answer is right. And right now, that answer of 3 is not right. That is not right, guys. No, 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 no. I'm glad I did this question today. So what are we talking about here? What are we talking about? We are talking about cellulitis. So cellulitis, great. We got that. We got the signs and symptoms. We got it. We got it. And so a lot of you guys were thinking this, okay, right? We're thinking cellulitis. That's all we had on our mind. And so when I asked you the question, all you could think about was cellulitis. However, NCLEX is very good at the end, making sure that you're reading. So the question that you want to know is which primary prevention statement is most appropriate. So we're not talking about cellulitis anymore. We're not talking about cellulitis, all right? And again, don't be afraid to get it wrong here. I want you to get it wrong here. I do. I want you to get it wrong here because then we can talk about it. So right now we're talking about with primary prevention, yes, Diana, we're talking about educating your patient. Educating your patient. Anytime it's primary prevention, it's about trying to prevent a condition. All right. It's about trying to prevent a condition. And so if we are doing that, we are educating the client on how to prevent complications, right? How to prevent it, All right. And so the patient had concerns of cellulitis. It didn't say he had cellulitis. It says he's concerned about it. So if this is something you're concerned about, what you need to do is use clean needles, because this is not the time to say, well, this is not the time to say you got to stop using drugs. Like we're not there yet. And then telling the patient that he has HIV and he should be safer. That's great. That is great. But that's not primary education for this specific case, which was cellulitis. Okay. So do we have it now? Are we all together? All right. Now we're all together on number 4. We're all together on number 4. All right. Okay. Here was a situation, because cellulitis is very important. It is a condition that some people are just not that familiar with. I have a lot of nursing students here. Welcome. Welcome. All right. So the question is cellulitis. I found a picture of what it presents like. So you can definitely see that there is a difference in the leg that has the bacterial infection. And bacteria is so aggressive when we get a bacterial infection. Sometimes there's literally nothing you can do for certain bacterial infections. They are so powerful. So they definitely change the presentation, the function of the cells. So my question is, with cellulitis, if it's just on the legs, yes, the legs look red and they look inflamed, but what makes cellulitis a life-threatening condition? If a patient some people get cellulitis on their cheeks, right? They can get cellulitis on their cheeks or their arm, and it's just a small spot. And yeah, the spot will grow, but what makes it so life-threatening? If a person comes in and they have a cellulitis on their cheek, why do we ring the alarms? Oh no, we have to do something for this patient right away. What are we worried about with cellulitis? What are we worried about? And I see the answers already. So yes. I love it. Thank you guys. This community is so awesome because you guys are so knowledgeable. Yes, this is a bacterial infection, and it doesn't take long for the bacteria, it enters that bloodstream and the patient becomes septic. It is not great. It is not great when that happens. All right. Did you guys know that? We are worried about the sepsis that results from cellulitis. And anytime a patient has a bacterial infections, I want you to think sepsis because it happens so quickly. And that's why when you talk about viral infections and bacterial infections, viral or like here, bacterial or up here, you definitely want to make sure that they are addressed very quickly. Sepsis. Good job, guys. All right, we are moving on. I'm giving you this one. Are you guys having fun studying? I'm having a good time. Next one is this. Almond-shaped eyes. A tongue that sticks out of the mouth. Flat nose. Seen in infants, also called trisomy 21. What am I talking about here, Remar nurses? What is this? Critical thinking. Name that diagnosis. Put the comments on the screen. Can we all be on one accord about this? Is this the one that will bring us back together in a whole way? And this is also ABC edition. I don't know if you guys like this ABC edition, but it also gives you another clue if you're keeping track of what letter we are on. And it seems like you guys are. I'm not going to, definitely not going to belabor this one because you guys have it. Just want to draw your attention for all of my new nurses that are here. You know, every Monday we get together and we study, and it is extremely important that we do that because sometimes it's lonely. Sometimes it's lonely preparing for NCLEX. And so this is actually Down syndrome, which we go over the characteristics. Now, it's very important to know, let me go back to my screen. It's very important to know these characteristics of Down syndrome, okay? Because when a client has Down syndrome, fetal alcohol syndrome, they will change the way that you look. They'll change the way that you look. So Down syndrome, very important to know the characteristics of what the infant will look like, All right. Yeah. And if you didn't know that last term, look it up. You may see it again. Okay. Good job, guys. We all came back together on this one. Let's try to do this one. This illness originated in Africa. The client presents with a fever, a headache, stomach pain, diarrhea, vomiting. Patient may bleed internally. So you may see internal bleeding, but also blood may come out from the eyes and the ears. It's a scary thing to see, but the presentation is very common. Okay. Isolation is required. Here. And if you really know what isolation is required, if you know if it's universal, contact, or droplet, or respiratory, go ahead and put it on the screen. But you gotta know. I like it. Thalassemia. Let's go, guys. This is how to pass NCLEX. How to pass NCLEX is definitely being able to take cues and anticipate diagnosis, complications, medications, therapies, interventions. That's what NCLEX is all about. So nurses, you have to have a handle on your content. The correct answer here is Ebola virus, the Ebola virus. Hey, did you get that one right? What do you say? I'm going to give you one more. Here we go, guys. Quick fingers. Frequent urination. Temperature 102. Burning sensation during urination. Chills, nausea, foul smelling urine odor. And this is not on the ABCs here. We've abandoned the ABCs, and I've just given you another condition that I really, really want you to know. So go ahead and put it on the screen. All right. And I see it. All right. We have been studying for over 20 minutes, and we literally just talked about 3 or 4 conditions. Answers on the screen. Biggest study session ever. This is, of course, the urinary tract infection. The urine is sterile. It's a sterile fluid. It's drinkable. I tell you guys that all the time. It's like blood. There should be no foul smelling bacteria growths in it. There should be no protein in the urine. There should be no glucose in the urine. It is a clean liquid when it comes out of your body. So if there is any presence of any of those things in your urine, something is wrong. Something is wrong. All right. The particles in the urine should be very, very small. So I am telling you guys this. I'm encouraging all of my nurses here to finish. If you like studying with me and you want to do my full program, please get in the NCLEX virtual trainer. We are the best NCLEX review for repeat test takers and international nurses. I'm telling you, I cannot explain it enough about how well my nurses are doing in the virtual trainer. And right now, this is Cyber Week. So hashtag Cyber Week. And just so you guys know, we did purchase more of the First Shift book, which is my book, How to Dominate Your First 2 Years of Nursing. And so this is the book that is really popular. Some students get it after they pass NCLEX, but others get it now. They get it now because I talk about what to put on your resume. These are all the things. If I was your preceptor and I was guiding you to your first job, these are the things I would tell you that are in First Shift. What to put on your resume. What interview questions you will need to be prepared to answer. You guys know I did travel nursing. And so with travel nursing, you have to interview every time you get a job. So I was literally interviewing, sometimes I would interview like, I don't know, every 4 months I was having an interview. Sometimes I would interview twice a month to different facilities, and nurse managers, they all like to ask the same things. So I put those questions and how I answered those questions in First Shift. Also, when you hit your first shift, what are the things you need to do? What do you say to the patient? How do you prepare? So all of these things are in First Shift, guys. This book will help you transition much smoother. My first 2 years in nursing, it was tough. It was tough. I wish I would have known these things. Also for the Cyber Week sale and hashtag cyber if you're on Facebook, if you want to know how to get these products. Quick facts for T's. If you are an LPN and you want to go back for your RN, it's very likely that you'll have to take the T's. So get the quick facts for T's and start studying it now, because T's is different from NCLEX. How many people know the difference? How many people know the difference between NCLEX and T's? So NCLEX, all about nursing, right? You had to take everything about nursing, how to care for the patient, the medications, the diseases, the intervention. T's, you got to know math. You got to know, and I'm not talking about just addition. You got to know fractions, percentages, algebra, geometry. These are the things on T's. Also, your science. You got to know about the periodic table. You got to know the genes, all right? The difference between a recessive and dominant gene. You got to know about cells, atoms, and electrons. T's is no joke, okay? It is no joke. And then also there's reading, how to know the difference between a paragraph, a main topic, directional words. I'm trying to think of all the things I go over in this book. And then also your language or English comprehension, all part of T's, right? And then these are the wonderful things that we have going for Cyber Week. The quick facts for NCLEX 5-star version. You can also get this on Amazon, but right now our site has the Cyber Week discount that you won't find on Amazon. So go to the website to get it. And of course, finally, last but not least, guys, I got to tell you about my full NCLEX review. This is the virtual trainer that my nurses are in. And we do have one. If you're a registered nurse, you get the registered nurse book. And if you're a practical nurse, you get the practical nurse book. So no matter what test you are preparing for, the VT is waiting for you. So all of you guys that signed up for it, I will be going back in the VT. Later this evening to get you guys set up so you can actually know when you hit that training center. The virtual trainer will give you the course selections that you can take. So we'll actually go into the RN course tonight, and we will talk about when you are completing the review. All of these are videos or homework or progress exams. So what it is that you should be looking for, how you should be taking notes. And remember, my NCLEX review, it is not a slideshow.
Each category,
it is not
a baby can
it
get
is actually
from a 0
an actual
to a
review
score
with my
of
classes
2.
and my courses.
So let's go through the categories and look at the characteristics
that will all be happening
that would give
this tonight, and we will definitely get into it. I'm so excited. I'm looking forward to the testimonials that are coming. Because literally 600 nurses are new to my virtual trainer. So I know that they will be passing soon. People are getting excited. The end of the year is happening. It's coming to a close. So hit up remarnurse.com. remarnurse.com. Yes, the virtual trainer. It is the real deal. Now, I do this segment called Monday Motivation. And so my Monday motivation is simply this. And this is something that I had to learn. And that is really, this is my motivation to you guys. Everything you want is simple to get. Seriously, everything that you want is simple to get. It's an idea. It's a concept. The things that we want, they are not mysterious things. It's not like people email me and say, Regina, I want to get a diamond that comes from Mars, right? It's not. People, what you want are the things that most people want. And they're really simple things. You want to have an amazing job. You want to be healthy. You want to be able to provide for your family. You want to be able to feel financially secure if something pops up, if your car breaks down, or you have a medical accident. You want to be able for your family to still have stability, right? You want to be able to put food on the table. You want to be able to be a blessing to others. Honestly, are those the things that you guys want? Those are the things that pretty much I want. Like I'm not trying to go to the moon. Well, I would like to go to the moon, but I'm not. Like day-to-day life, the things that I want are very simple. However, I have come to learn the older that I get, the more experience that I have in life, that even though things might be simple, you guys are saying yes. That even though the things may be simple, okay, to get, I said they were simple. I didn't say they were easy. And that is oh my goodness, that is the challenge. Just because it's simple, that doesn't mean it's easy. Just because it's simple, that does not mean it's easy. So yes, we want to have the job of our dreams. That's simple. But what does it take to get the job of your dreams? Well, if you want to be a nurse, it takes you going to nursing school. How tough was nursing school? Oh my goodness. Listen, we barely survived it, if we want to be honest. Mentally, we got out of there, but we are still processing all that it was, right? And so nursing school, difficult, right? Studying for your NCLEX, it's a challenge because you would assume that if you got through nursing school, you would just be able to go and take this test and pass it. But no. They make our test unlike a test we have ever seen in nursing school. We have never seen a test like this in nursing school. So we cannot just say, nursing school, thank you so much. Like it's very tough. It's a different type of test. So yes, to get your nursing license, it is a simple thing to do, but it's not easy, right? Being healthy. We want to be healthy. We want to be at our ideal weight. Losing weight, it's a simple thing to do, but it is not easy to do. Providing for our kids. Who knew how expensive kids were? Nobody told me how expensive kids are, and especially as they grow. Or is it just my kids? My kids, you should see these Christmas lists that I'm getting. Remember when we were younger, we would make a list and you would get one thing off the list. That's how my household was. I would make a list of the things I wanted. I might get one. I might not get none. I might not get any of them depending on my behavior because my mother didn't play, right? So I might have gotten one thing off the list. Now kids today, they make you a Christmas list. There's 15 things on the list and they want 15 things, right? And so kids today, it is a lot to provide for your children, right? Giving them what they need, giving them the things you would like for them to have. Simple, all right, but not easy. Okay. All right. And of course, if you're an international student, even more, we're talking about getting into the situation where you can prepare for your NCLEX. You got to take a language test. You got to pay fees. You got to look at your transcripts. And so these things are all difficult to do, right? They're difficult to do. So what does it take for you to get there? It takes you being better than who you were yesterday. All right. And that just means whatever you did yesterday, you got to do a little bit more today, because it is a challenge. If you just look at, well, I studied yesterday, I called them yesterday, right? That will not carry over. Every day, you got to take a foot and put it in front of the other one. You have to make forward progress, because what I have found is that if you don't make forward progress, then 6 months will go by and you will not have done anything. And I'm preaching to myself right now. There are things that I said I was going to do, and I keep saying, well, I'll do it tomorrow. I'll do it tomorrow. I'll do it tomorrow. And then it never gets done. And so that's why I did an International Nurses Day. Even though I said I was going to do it back in the summer, it was just like, I have to do this thing. I have to get it done because I wanted to do it. And my International Nurses Day was so fantastic. I'm so glad I did it. I'm so glad it helped so many people. And I want you to have that experience. I want you to say, okay, I said I was going to do it. I told people I was going to do it, but I didn't do it. So now I have the opportunity to do it now. And I want to do it now. So this is my testimony. I'm so glad when I do the things that I say I'm going to do. It feels so good. It feels so good. And so if you are ready, because literally we just have a few weeks left in this year. And some of you guys missed our Black Friday review. You missed the review. You also missed the discount. So now Cyber Week is another opportunity for you to get the virtual trainer, get your license. I want to see these testimonials. I want to see you guys happy and healthy with the job of your dreams. And I'm going to tell you this. When it comes to studying for the NCLEX, it is not easy. All right. But it can be done. All right. So like, for example, in the virtual trainer, I'm going to show you guys the list. Like, these are all of the videos that I need for you guys to watch. Okay. And these are them. We come here and we study for a short time, but when we're done, you guys have a work to do. All right. And I'm going to scroll down here and I'm going to tell you there are 65 units in my virtual trainer program. Okay. And you will go over them. You will go over the topics that you need. We did orthopedics on Black Friday, if you missed it. We did antibiotics. We did IV therapy. We did TPN. And so that's why I said Black Friday. The Black Friday review was an amazing kickoff for my nurses in the virtual trainer, because we literally did those reviews together. And I went back over and I talked about the important points. So now when they get into the virtual trainer, they have to pick up with the substance abuse, right? IV fluids, clinical math. These are things that, hey, you cannot prepare for your exam without doing positions, disaster management, especially if you're an RN, blood gas interpretation. I got chest tubes down there. Okay. So a lot of topics for my RNs and a lot of topics for my PNs. And so, yes, you guys have to find the time to do this. You've got to find the time to do this. And that's the challenge. Number one, do you have time out of your week? You better make it. You better get up early. All right. You better get up early. You better stay up late. You better cut out the TV. You have to do something, because it's simple, but it's not easy. It's simple to get your nursing license, but it's not easy. But once you do, I'm telling you, you're going to be so happy. Do you see the testimonial videos that I show? These nurses are happy. They're smiling. They're light because they have done the work, and it pays off. Once you get your license, you never have to worry about it again. All right. never have to worry about it again. So that's what I'm encouraging you guys for this week. Understand that yes, it's simple, but it's not easy. It's not easy. So my nurses are passing 99.2 success rate. You got to make a sacrifice, guys. And so the next thing that I want you to do when you get off of this live, if you have not gotten started or if you don't have the virtual trainer, please go to the website remarnurse.com. remarnurse.com. That is where you need to go, and you will see the Cyber Week deals. Also, I see some people asking, does the virtual trainer, it has questions. Yes, you will also get access to the questions as well. But I want you guys to focus on your content first. So get into that. I want you to have a training center mentality. I need to get my training, because we all know the most challenging thing about losing weight, the most challenging thing about making a change is that working out. It's that training. That's what I hate. I don't like the training, but it is the most important part, right? So also hashtag cyber. Hashtag, anyway, like that. Hashtag cyber if you want a direct access on Facebook, okay? I'm just putting it out there too. So 2 great ways to get started. 2 great ways to get started. And this is my final push for you guys, because I feel like it's the final opportunity of this year. We got Thanksgiving in the books. Next is Christmas. What's after Christmas? New Year's. It's going to be a new year, and you guys are going to get closer and closer and closer to that NCLEX changing. I'm trying to get all of my nurses not to take the next gen NCLEX. And I love it. I love it. I think it's going to be phenomenal. But I got a group of y'all who need to pass NCLEX and be working as nurses and not studying with me. I love you guys, but in 2022, I really don't want to see you. I want another generation of Remar nurses to come through here. That's not you. But you got to get your license. So let's commit to doing that. All right. Thank you. Thank you so much, guys. Hashtag cyber, because it's Cyber Week. And for today, I'm doing something really different. I'm giving an additional discount only for today. So that's another thing I wanted to say. We have Cyber Week all week, but today, Monday, I'm doing an additional 30% off. Okay. All right. So I want to see you guys there. Hit up the website, remarnurse.com. And as always, guys, you can, you will, and you must pass NCLEX.